Well, warm welcome to today's talk, Monday the 20th of December. We're going to be looking at the United States where the Omicron surge has started. But first of all, and we're going to look at the UK, and we're going to take some data from Professor Hoiby as well. Hope you caught that video earlier. But let's just start off with some orientation first of all. Well, the graph just speaks for itself, doesn't it? Dear me. Now, Australia, Canada definitely increases there, isn't there? There's no question about that. And we believe that this is largely Omicron driven now. United States, it's been flat, but the Omicron surge has started now in the States. This is an underrepresentation of the total number. And the United Kingdom, well, there you go. That is what Omicron does. So if you want to know what an Omicron surge, or at least the start of an Omicron surge looks like, then there you go. That is the graphic. It really is quite startling, isn't it? Quite a surge. Number of COVID-19 patients in hospital per million. Thankfully, not a great increase. In fact, pretty flat. Slight increase in the UK. Now, the United States, the hospitalisations are actually started going down a bit after their recent Delta surge. So this is the Delta effect in the United States. United Kingdom is a combination of both. Canada, much lower hospitalisations so far, although they are getting increasing Omicron cases now. New daily confirmed COVID-19 deaths per million. Well, United States, the deaths have remained, unfortunately, really fairly high. UK death rates are going down. Canada looks like they're drifting down. Australia, they're drifting down. And Japan is still doing remarkably well. So certainly not transposing into deaths at the moment, which is remarkably good news. Let's hope it stays that way. New daily confirmed COVID cases per million. This is just another graph just to show us United Kingdom, United States, and this has got South Africa on it. Now, interestingly, fascinatingly, in fact, South Africa, it looks like their data of terms of cases have started to go down a little bit. That's really quite interesting. We believe that in Gauteng the cases are already starting to go down, so that could well be a short wave in South Africa. So if you follow the South Africa line, we can see the waves there. First wave, second wave, third wave, fourth wave. It's higher than the other ones, but it looks like it could be narrower as well, which would be good. Just a bit of European comparison. Denmark, very high cases in Denmark. But maybe the infectivity in Denmark's no higher because they've just got very good surveillance in Denmark. Although they are quite concerned about it. United Kingdom, France increasing, Spain, Italy now increased to where the United States is. So no question we are seeing increases in Europe. Now, we're keeping an eye on this critical data here from South Africa. So 8,500 people in hospital in South Africa who've had a confirmed COVID diagnosis. And we know that 98%, probably 99% of the cases of COVID in South Africa are in fact Omicron. So this is basically the Omicron situation in hospitalisation in South Africa. Population of 60 million people, 8,500 people in hospital. Very slightly higher than the UK at the moment, very slightly higher. 566 in intensive care, 589 in high care. So not a dramatic increase. And the number of patients requiring oxygen as of today, but this will be yesterday's data, of course, 1,200. 229 in the whole country requiring ventilation. So for a country of 60 million people, just over 1,200 people are requiring oxygen in South Africa, which is startlingly good news. Now, moving on to, so that's the South Africa data there. Moving on to the United States, I'm going to use this example here. Houston Public Media, part of the University of Houston, Houston Methodist Hospital, one of the big hospitals, of course. The testing they're doing, Omicron variant is doubling every 2 to 3 days in the United States. Or at least in the Houston area. This is, of course, exactly what we predicted. We've got a double in times of 2 to 3 days in the UK. And we've been saying for a good couple of weeks now, we'll get the same situation in the United States. We're starting to see that at least in this Texas area. Now, at least 45% of Methodist COVID-19 patients were Omicron positive as of Friday. 2 days before that, it was 32%, and 4 days before that it was 13%. So it's gone from 13% on the Saturday, Sunday, Monday, Tuesday, Wednesday. 4 days later, 32%. Wednesday, Thursday, Friday, 2 days after that, 45%. I mean, that is the sort of increase you're getting, 15 to 32 to 45. And of course, by now it will be, well, what will it be? 60, 65% now at the moment. Half of the hospital's Omicron patients have been vaccinated with either 2 or 3 doses. So we're clearly seeing a massive breakthrough infection. That's no doubt about that. 4 times as many positive COVID-19 test results since last week. Yeah, so it's increasing exponentially. That's what we said. And it's fueled by Omicron. That's where the cases are coming from. Now, just before we go on, let's just look at the United States in general here. And we do see this great increase in cases as we're starting to see the effect of Omicron now in the States. So that is definitely started. Just check on the deaths, daily deaths in the States. Well, yeah, I mean, but these are as a result of the previous Delta surge. This is nothing to do with the Omicron, but they do remain stubbornly high. And just looking at hospital admissions in the States, it's a bit small, but there you can see there's a slight downturn in most age groups we see here. So the hospitalizations as a result of the recent Delta surge just starting to go down now in the States. But of course, this is Delta related. Dr. Marc Boom, Methodist President and Chief Executive Officer. If this spreads so rapidly that there are massive numbers of infected people, even if on average they're mild, if that hits the vulnerable in our population and they end up in hospital, that can still be an incredibly challenging time. So again, what we're saying is what many people have said this now, even if the cases are mild and the vast majority of people don't get ill, because we're getting them all at the same time, and it looked like the South Africa wave was remarkably small. This could all be over in just a few weeks, but it could be a lot of people all at the same time is still the concern. But we are not seeing that at the moment nationally. In terms of hospitalizations in the States, we are not seeing that, at least yet. And as you'll see, we're not seeing it in the UK either. Dr. Wesley Long, Medical Director of Diagnostic Microbiology, very likely will reach 100% of COVID cases in hospital by January. Now, if that's the case, it would be good, but he does put a proviso on this in a minute. That would be a faster sweep than the Delta variant, so it's increased very, very quickly, which took about 3 months to sweep the other variants out of the way. So if it became 100%, that would be good, but he does say it's possible that Delta remains in some equilibrium with Omicron over time. And the latest data that we're getting from the UK is that the Delta cases are still there. It's just that the Omicron are building on top of that. Now, I'm still hopeful that the Omicron is going to displace the Delta, but it's not happening. At least it wasn't happening last week, according to Professor Whitty's data. United States generally, so that was the cases and hospitalizations that we looked at. That was my term there, rip-roaring away. The Omicron is rip-roaring away. Could bring the highest levels of cases yet, according to official sources, and that's clearly true. This is the number of infections, of course, and cases, not the number of hospitalizations or deaths or anything at the moment. New York is a bit of an epicenter for Omicron. Bill de Blasio, we are seeing a very substantial rise in the number of cases in a way that we haven't seen previously. So again, we are seeing the most rapid increase yet. Everywhere the Omicron variant rears its head. Now, massive increase in cases in New York, representing a massive increase in infections in New York. But New York has got at least 94% of adults with 1 dose. Two doses, 70% of adults, 10% above the national average. So if it's rip-roaring its way through New York, 10% above the national vaccination average, it's going to be certainly doing the same all around the other states. So the vaccine's not protecting very much or that much against, at least 2 doses of vaccine, not protecting that much against getting the infection, but we do believe still preventing a lot against hospitalizations and deaths. Dr. Fauci says it's raging around the world. Omicron variant is really something to be reckoned with. Our hospitals, if things look like they're looking now, in the next week or two are going to be very stressed. Well, we don't know that one yet. It's not the case in South Africa. And so far, it is not the case in the United Kingdom. And South Africa is ahead of the United Kingdom in terms of Omicron. And the United Kingdom is ahead of the United States in terms of Omicron. So we're not seeing that yet, Dr. Fauci. Not yet. The data's not indicating that from the UK or South Africa yet, but you're right to be prepared. But again, we have so many people in this country who are eligible for vaccines have not yet been vaccinated. But it does say the hospital to case ratio appears to be smaller than Delta. So for the number of cases that we're getting a smaller proportion of hospitalizations with Delta. But of course, we're going to get a lot of cases at the same time. Dr. Fauci again, we're going to see breakthrough infections. Well, of course, we've known this for some time. The difference between a vaccinated and boosted person who's had an infection and someone who's had an infection who's never been vaccinated. Complicated language, but that's a direct quote. There's a major difference with regards risk of severity. So what Dr. Fauci is saying, and this is consistent with the UK data, less consistent with the South Africa data where they have a lot of natural immunity. But what he's saying is people that have had 2 or 3 doses of the vaccine, even though they can get the infection, even though they can become a case, even though they can become symptomatic, they're very much less likely to become severely ill. And that is consistent with the international data. President Biden's going to announce his winter plan tomorrow. At the moment, there's lots of flights and travelling for Christmas. But Broadway shows have been cancelled, some sports events have been cancelled, and some education is going remote. Now, let's just look at the United Kingdom now. I want to start with a COVID symptom tracker study. So this is the prevalence, 1.36 million symptomatic cases in the UK at the moment. An extra 129,000, 130,000 really, isn't it, symptomatic cases in the UK. And we can see that the numbers there are increasing. The line is going up quickly and the dots are further apart due to the rapid rate of increase. And here we have the official UK data, and we see this great increase in people testing positive over the last 7 days. Now, moving on to the Omicron in the United Kingdom, that was the new cases of Omicron on Sunday. That would be Saturday. That was the new cases on Sunday. Anyway, that's the latest data we've got. So we see a decrease there. That doesn't mean very much. Officially diagnosed Omicron, 45,145. The real number, of course, is way higher than this. We're not catching them all. The real number is going to be 100,000, 200,000 new cases per day. Way more than this, and has been for some time. Because, of course, most cases simply aren't picked up. So how is this transposing to hospitalisations and deaths in the UK? Now, this is the critical point. That's on this government website. Check it out. I've just done this half an hour before I came onto this talk. Hospitalisations in the UK. Remember, there's about 7,500 people in hospital in the UK with COVID. 129 of those have got Omicron confirmed, and that's either confirmed by genomic testing or S-gene target failure. 129 in hospital. And deaths in people that have tested positive for Omicron, 14. So let's just look at the hospitalisations actually in the UK at the moment. So if we go into healthcare here, and we look at the actual number, so that's 919 patients admitted. So they're patients admitted to hospital. Here's patients actually in hospital at the moment, and we see that number is, as we said, 7,500 people in hospital. Of those, 129 positive for Omicron. It looks like if Omicron carries on increasing, this could dramatically reduce the number of people in hospital. from the data we have so far. It could change. It could change. But so far, it hasn't. In South Africa, it hasn't. This is, to me, remarkably hopeful. So let's just juxtapose that. We've got 7,500 people in hospital, and that's as of the 17th of December, whereas this data here is as of the 18th of December. So it's actually more up-to-date data. 129 people in hospital with Omicron. 14 deaths, sadly. But that 14 deaths, of course, needs to be taken in context as well. Because if we look at the deaths in the UK, what do we see? Let's look at this one here. So we see that the deaths in the UK are about well, if we look at the past, what is it for the past week? It's it's 44 daily, isn't it? Weekly on the death certificate, 909 deaths, as opposed to the patients that we know have died of Omicron, which is 14. Still quite possible that Omicron is going to sweep away the Delta severe cases, hospitalizations and deaths. Don't know yet, but South Africa's looking good. So far, the UK is looking good. United States, way too early to tell. Now, the other parameter we're keeping an eye on for the UK, because London is so much ahead of the other parts of the UK. Now, this is the hospital admissions in London. They are going up. They are increasing. But we do know that about 50% of the patients in hospital in London who have been confirmed to have Omicron, about 50% of those were incidental findings. They were admitted for something else. That was the professor, what's his name? I've forgotten his name. Anyway, there was the one for the public understanding of risk, Spiegelhalter or something. Apologies, Professor, I messed your name up. So quite a few of those incidental findings. Admissions, 210 London hospital admissions altogether. So London hospital admissions not surging at all. Up, but not surging, not at all. So we're going to keep an eye on that figure as well. 129 people in hospital with Omicron, 14 deaths. Way less than we had with Delta so far. Now, just to finish today, I hope you got the chance to watch that video from Professor Niels Høiby that we did this morning. One of the most senior medical microbiologists in the world, probably one of the most published I've ever come across. Anyway, that's for sure. Now we've got some. Now his data's not published yet, but we've got some data from Professor Høiby here. Total vaccinated in Denmark with an mRNA vaccine, 4.3 million. Total myocarditis and pericarditis cases, 129. That's one case of heart inflammatory disease in 33,369 vaccines. Now in Denmark, the vast majority of the injections are aspirated. So the needle's stuck in, the nurses, doctors draw back to make sure they're not in a vein, and only then do they inject. In the UK, we're not doing that. In the United States, we're not doing that. This is an appalling situation, but it is the case. So that's the situation where they are aspirating in Denmark. Norway, where they are not aspirating, 3.7 million mRNA vaccines given. Total myocarditis and pericarditis cases, 274. That's one case in 13,000. So, would you like your risks to be one chance in 33,000? Or would you like your chance to be one chance in 13,000? Would you like to reduce your risk by 2.4 times? Because there's 2.4 times more cases of inflammatory heart disease complicating vaccination in Norway compared to Denmark. So it seems that we can reduce the risk by 2.4 times, not 2.4%, 2.4 times by introducing aspiration. If this data is indicating that, which it seems to be. Professor Hoyb has done the stats on this, and it is significant. This is not a chance finding. This is a significant finding. So there we go. With aspiration, 1 chance in 33,000. Without aspiration, 1 chance in 13,000. The whole world needs to change to start aspirating. And if this data is continued around the world, reducing the chances of inflammatory heart complication after vaccination by 2.4 times. I'm convinced. Okay, that's us for today, and thank you for watching.